in line with the Health Insurance Task Force recommendation, MOH will issue the following requirements for all new rider plans with immediate effect. New IP riders must incorporate co-payment of 5% or more. To address concerns from some policyholders that they may face high co-payment amounts due to the unlikely event of very large bills, the new riders will have a cap on the co-payment amount each year. Most insurers are planning to launch their new riders with an annual cap of $3,000, though they are allowed to set higher thresholds. This places an upper limit on the risk exposure for policyholders to protect them against very large bills. New riders will be available within a year. In the meantime, insurers can continue selling their existing rider plans, but must inform new policyholders that they will transit to the new riders with co-payment from 1st April 2021. Once the new riders are ready, these policyholders can choose to switch to the new riders earlier if they wish to do so, and any pre-existing conditions that are covered prior to the switch will not be excluded. We expect the new riders to have lower premiums than full riders, so the switch will result in premium savings for policyholders. Let me be clear that MOH is not issuing these requirements to bail out the insurers. Our objective is to address the concerns with overconsumption, overservicing, and overcharging, as these will lead to patients and policyholders paying rapidly escalating fees and premiums over time. It will be an unsustainable and undesirable outcome for Singapore, especially when we are aging as a society. Policyholders can continue to tap on MediSave to pay for their co-payment amounts under the new riders. At 5% co-payment, half of the inpatient bills in 2016 would have a co-payment amount of $100 or less. 3/4 of inpatient bills would have a co-payment of $250 or less. And 9 in 10 inpatient bills would have a co-payment of $550 or less. The 5% co-payment can be covered within the current MediSave withdrawal limits for 99% of all inpatient bills. For private hospital inpatient bills, in 2016, 1 in 2 would have a co-payment of $380 or less, 3 in 4 would have a co-payment of $670 or less, and 9 in 10 would have a co-payment of $1,270 or less. The above requirements will apply to new rider policies. We recognize that existing rider policies are commercial contracts between insurers and their policyholders. If insurers intend to make changes to their existing policies, they should consider the interests and well-being of all policyholders as they seek to keep premiums affordable for everyone in the longer term. The requirements for new riders will not affect MediShield Life and integrated Shield plans, which already have co-payment features. For patients who face financial difficulties with their bills, MediFund remains available as a safety net to ensure they continue to have access to quality, subsidized healthcare in our public hospitals.